All right, this is just too painful to watch. This is the last thing you want to do to your teeth. In the current era we work in, we work with the minimal invasive concepts of cosmetic or aesthetic dentistry. The last thing your dentist want to do is just drill your teeth as much as he wants to bring in tooth structure and change the shape and color of your teeth. This is the last thing you want to do. Let's face it, whatever you do in your mouth, it's gonna fail in the next 15, 20 years and you need a replacement. If you have done teeth like this, what do you think? What are you planning to replace in the next 15 years? Do you have something remaining to do that? Crowns are your last resort. The reason I'm saying that is because it's good for people who have previous decays, cracks in their teeth, previous failing restorations, and we have no other option to remove everything and utilize whatever is remaining to restore it as good as possible so it gives them a long-term prognosis. Now let's reverse this. If you as a young patient or someone with good teeth, even if they're middle-aged patient, we want to save that tooth as much as possible. So in the next 15, 20 years, we need another replacement of the teeth. We have enough tooth structure remaining to do that. So think twice if your dentist wants to drill your tooth just like that.